Good morning. I'm Terry Poore, the Policy Director of the National Alliance to End Sexual Violence. I'm so glad you've joined us today for the essential role of rape crisis centers, services, prevention, and recent data, a virtual congressional briefing for congressional staff. Thank you so much for joining us. We are recording this webinar. I'll tell you a little bit about our agenda for today. First, you're going to hear from Monica Johnson-Hostler, our President and CEO, and then from several of us on the National Alliance to End Sexual Violence team. We're going to share some background information, some recent data, and then Ellen Fern from our team is going to talk about our specific congressional requests for this year. And then we have some really wonderful guest speakers. Sherry Hyatt, the Executive Director of Family Service Centers of North Alabama, Nancy Hoffman, Executive Director of the West Virginia Foundation of Rape Information Services, and Rose Luna, Executive Director of the Texas Association Against Sexual Assault. And then we will take some time for Q&A. If we have time, please use the Q&A function at any time during the briefing, and we'll make sure to try and get to your questions. And then we'll close at the top of the hour. So thank you so much. I'm going to turn it over to Monica Johnson-Hostler, the President and CEO of the National Alliance to End Sexual Violence, and also the Executive Director of the North Carolina Coalition Against Sexual Assault. Thank you so much for joining us.
Thank you again for joining us, and thank you, Terry, for the introduction of today and for your facilitation throughout the remainder of this briefing. My name is Monica Johnson-Hostler, and I'm the CEO of the National Alliance to End Sexual Violence. We serve as a statewide force, the voice in Washington for the 56 state and territorial sexual assault coalitions and over 1,000 local programs that are working tirelessly in communities to support survivors and prevent sexual violence. As we come together this April to honor Sexual Assault Awareness Month, it is critical that we recognize and amplify the life-saving work of rape crisis centers across this country. Today, we will share key highlights of the vital work that our programs are doing, but also the ongoing needs of survivors and victims. You'll also hear directly from state coalitions in Texas and West Virginia, as well as a local rape crisis center in northern Alabama, offering invaluable insights into their impactful work. One of the most effective ways policymakers can support victims and help sexual assault in this country is by championing federal programs that fund services and prevention efforts. Throughout today's briefing, you'll learn from our team at the National Alliance to End Sexual Violence about how programs like the Victims of Crime Act, Sexual Assault Services Program, Rape Prevention and Education Program, and the Office of Family Violence Prevention and Services work in tandem to support local programs in their response and prevention to sexual violence. I'm incredibly proud of our network of dedicated advocates who on the ground bring their passion and commitment to this work every single day, 24/7. Our programs are not only employers in their local communities, but they also serve as vital hubs. For us, this work is a life's passion and mission. We are grateful for the long-standing bipartisan support our programs have received, and we hope we can continue to count on you to ensure that survivors of sexual assault have the resources and opportunities they need to heal and rebuild their lives. Now I'll turn it back over to Terry Poore, our Policy Director.
Thank you, Monica, for your amazing leadership of our important work. Okay, I'm going to provide a little background for folks just to understand a little bit about our work, the work of rape crisis centers, and just some background information about the network of sexual assault programs in the country. So as Monica said, the National Alliance to End Sexual Violence works to support people who have been raped and sexually assaulted and to prevent those crimes from occurring. We represent about 1,000 community-based rape crisis centers that help survivors put their lives back together after violence. We also serve 50+ sexual assault coalitions in the United States and territories. We push for strong federal policies that deliver real solutions for survivors of rape, assault, and other forms of sexual violence. And we ensure that community programs in every part of the country can effectively use federal funding to provide critical support to survivors. and increase safety in all of our communities. So, what is sexual assault? I know this seems like a very basic question, but we feel like we should start at the beginning and just say a word or two about that. So, we most typically use the Violence Against Women Act definition of sexual assault, which defines sexual assault as any non-consensual sexual act prescribed by federal, tribal, or state law, including when the victim lacks capacity to consent. And so we know that state law really in the criminal realm is the biggest governing force, but that there are certain also federal and tribal laws that we're looking at. And so it's important that it's a broad definition because state definitions vary quite a bit. But we know this includes knowingly cause another person to engage in a sexual act by force, threatening, or placing that person in fear. So both direct assault and also coercion, in addition to many other forms of sexual violence, including engaging in a sexual act with another person after knowingly rendering that person unconscious, and knowingly engaging in a sexual act with another person if that person is incapable of appraising the nature of the conduct or is physically incapable of declining participation. So, defining sexual assault is a pretty broad thing, but we know it's important to set that as a foundation. So, in terms of setting some context for the issue of sexual assault, we rely pretty heavily on the National Intimate Partner in Sexual Violence Survey, and this is based on a report that came out in 2023. So, we know the prevalence of sexual violence is high. 26.8% of women and 3% of men have experienced a completed or attempted rape in their lifetime. We also know that sexual assault is an issue that particularly impacts the young. Almost half of female victims of rape were first raped before the age of 18. So we know this is so important when we think about our prevention and response efforts, that this is really a problem that impacts youth. We also know that the majority of victims know the person who harmed them. Over half of female victims were raped by an acquaintance, over a third by an intimate partner, 16% by a family member, 12% by a stranger, and almost 10% in a brief encounter situation, and 4% by a person of authority. So just sort of setting the context for the prevalence of sexual assault, we also know that sexual assault has an enormous economic impact on our communities, and that federal funding for victim services is a smart, high impact investment in addressing this problem. The data is clear. Services reduce long-term costs, improve public health, and make communities safer. But sexual assault does have a major economic burden on individual victims, but also on communities broadly. So we know that rape costs each survivor more than $122,000 over a lifetime, factoring in medical expenses, criminal justice activities, and lost work productivity. We also know many victims end up dropping out of school, and that sexual violence costs our economy nearly $3.1 trillion over the lifespan of all 25 million victims in the US population. So a very costly problem, both to individuals and communities. We know that every dollar invested in services and prevention creates a ripple effect of savings and societal benefits. Services and prevention funding stabilizes families, reduces long-term health expenses, minimizes lost productivity, decreases homelessness, and eases the financial burden on the criminal justice system. It also fosters safer communities, empowers survivors to heal, and prevents future harm. So not only is it an ethical imperative to make sure we have a services delivery system for survivors of sexual assault and prevention in our communities, but it also makes a lot of economic sense. Now, who are the programs and local communities that are providing these services? We use the term Rape Crisis Center broadly, but the truth is these programs have a variety of different ways that they provide services. So we wanted to talk about that just a little bit. There are definitely some standalone rape crisis centers throughout the country, often in larger urban areas, that provide services to sexual assault across the lifespan, including recent victims of sexual assault and also people that were sexually abused in childhood or an earlier time. We know that victims often need crisis response, but often they also need a long-term response as well. And then there are sexual assault nurse examiner programs that provide the forensic exams after someone is sexually assaulted. Many programs are dual sexual assault programs and domestic violence shelters, both together in one program. That's a very common way that services are provided. In many cases, sexual assault services are provided as part of a larger multi-service agency, maybe a mental health agency or a substance abuse agency or a children's advocacy center that's combined with also sexual assault services. Also, very importantly, there are culturally specific organizations that provide sexual assault services, and we see that as absolutely imperative to meeting the needs of all victims in a community so that victims have a place to go where they feel very comfortable and receiving services. And then there are also tribal sexual assault programs. So you can see we use this term rape crisis center broadly. As Monica said, we see rape crisis centers as really a hub, but they come in a variety of formats, but so vital for victims of sexual assault in their communities. And they provide services, support, awareness, and advocacy to all across their lifespan. And they lead their communities on community awareness and prevention of sexual assault. So what do rape crisis centers provide? What services do they provide? They serve victims in rural, suburban, and urban neighborhoods all across the country, and they are on the front lines 24/7 responding to sexual assault in their community. They answer emergency hotline calls in the middle of the night from victims in crisis. They meet survivors at a hospital or SANE program to support them during forensic exams. They lead support groups. They provide counseling both during the immediate crisis and when the abuse happened in the past. And they offer victims and families guidance through the criminal justice system. These centers don't just offer services, they save lives, but they rely on federal funding to keep their doors open. Without sustained investment, survivors will be left without support and communities will lose essential crisis response services. So we see these programs as so incredibly important to community safety and community health. Okay, now I'm going to hand it over to my colleague, Maureen Gallagher, who is the Policy and Programs Manager at the National Alliance to End Sexual Violence, to talk to you a little bit about the data, information from our annual funding survey.
Hi, everybody. Thank you for joining us. I'm happy to talk to you about one of the really important projects that we work on at the Alliance, and that's to gather information from rape crisis centers across the United States and territories. We do this annually. The survey that I'll be talking to you about today was conducted at the end of 2024. So we asked folks about, you know, the questions that we ask focus on the last year of services, what they are experiencing, what are the challenges, what are um, what are survivors facing in their communities, and what their organizations are facing, so that we can then share that information with policymakers and others to let you know what is actually happening on the ground in cities, in towns, in rural communities across the United States and territories. So the points that we'll touch on today are the survey responses related to funding of local rape crisis centers, staffing, and services. A little background on the survey itself. We reach out to the rape crisis centers in the 56 US states and territories. They were all invited to participate. And this includes folks who identify as rape crisis centers, or as Terry said, we also reached out to tribal programs, culturally specific programs. So in order to gather information from a wide variety of service providers in communities. So this just tells you a little bit about how we reached out to folks and recruited them and did some targeted outreach. And we're really pleased to have had 507 completed responses from 47 states, as well as District of Columbia, Guam, and Puerto Rico. And this is a really, this was probably our most robust data collection that we've had in a number of years. So in the first area I'll talk briefly about is, the responses to the questions that we asked them about what has their experience been with their own resources and their own funding over the past year. And we found in the survey that 40% of centers saw a decrease in funding for direct services for survivors of sexual assault, and 35% saw a decrease in funding for the prevention of sexual violence. And as Terry mentioned earlier, these are both key components to the work of rape crisis centers. And you'll see here this quote from a Texas Rape Crisis Center talking about the cost of operating the organization increasing, and when funding stays the same or decreases, they're facing the prospect of scaling back services. And that's a sentiment that we heard from a number of folks in the survey. With regard to staffing, nearly half of rape crisis centers experienced a reduction in staffing for sexual assault services and/or prevention in the past year. 84% indicated that they need additional staff to meet the current demand, and 61% report having no full-time therapists or mental health counselors on staff. And you'll see that the Florida Rape Crisis Center example talks about the cuts that they have to make on their team, eliminating positions, but also the work is still there. The work is still needed. Survivors still need support. And so staff members are taking on much more work without extra compensation. And I will note that the staffing reductions have most commonly impacted the services related to counseling, prevention education, outreach and awareness, and the provision of support groups. And of course, with staffing and funding decrease, services are still, as I said, in demand. 60% of programs report an increase in demand for sexual assault prevention education. Nearly 60% report an increase in demand for sexual assault services. 44% reported an increase in demand for services for adult survivors of sexual abuse. And 85% of the rape crisis centers reported that they did have a therapist on staff, but that 35% of those have wait lists for trauma-informed therapy, and 66% had wait lists for counseling. So we know that the need is great. The most common unmet needs of survivors that were identified in the survey include housing, basic needs such as clothing and food, emergency medical services, and transportation. So unfortunately, with a decrease in funding and an increase in service demand, there really is folks are at a critical point in determining what's going to happen in the future of our work and their work in communities. And I did see that our funding infographic was dropped in the chat for you all, so you'll have these data points to refer back to. And with that, I'm going to turn it over to my colleague, Ellen Fern, who is the policy consultant for the National Alliance to End Sexual Violence, to talk about our congressional requests.
Thank you so much, Maureen. Hi, everyone, and thank you all for joining us today. I know it's a really busy time, especially for our friends in the Senate. But I wanted to quickly now get to the guts of the matter, so to speak. What will you be hearing from your constituents and other allied organizations when they come to you and with specific funding requests for fiscal year 26? And so on this slide, we've highlighted for sexual assault, our 5 primary asks, which include the Victims of Crime Fund, Sexual Assault Services Program, Rape Prevention Education, and a new initiative that we are advocating for around rape crisis services, and a new partnership intersectional demonstration project that we'd love to get off the ground through legislation and funding. So let's start with the Victims of Crime Act. Many of you I'm going to guess, have heard from your constituents and many others about the importance of VOCA. This is a non-taxpayer funding stream that goes out by formula to every state to provide services for victims of crime. For rape crisis centers, this is a critically important funding stream that goes to the state, and then the state funnels it down as one of many services that a state wants to support for victims. But these funds are released each year from the Victims of Crime Fund. That is where the fines and penalties that the criminal fines go into this fund from federal prosecutions of big white collar criminal cases go into this fund, into the Victims of Crime Fund. And so that's why each year there's a different amount of money in the fund depending on these penalties that have come in. And so each year, up until the very last minute, appropriators look at the fund, see how much money is there, and then release as much money as they can while maintaining some money in the fund for consistency and to look in the future. In fiscal year 24, $1.3 billion was released, and that was a big cut from fiscal year 23, actually, when the fund $1.9 billion was released. We were thrilled that in the fiscal year 25 continuing resolution, the amount of money released from the Victims of Crime Fund went up back to the 23 funding levels of 1.9 billion. That's because there was enough money in the fund to do that while maintaining funds still as we now look forward to fiscal year 26. These funds are critically important for programs. They're very flexible funds. They literally can keep the lights on and help with staff salaries and services. So you will be hearing about the ongoing importance of VOCA and the ongoing concern about the greatly fluctuating amounts of money that are going into the fund. And so your constituents for fiscal year 26 are going to be will be asking for at least 1.9 billion to maintain that level of funding for VOCA, but really the message is that programs around the country need steady funding to keep the doors open and services going. The next slide, we are highlighting a specific bill that we have been working on starting for the last two Congresses, actually, and many of you might have heard of this, called the Crime Victims Fund Stabilization Act. It has been introduced in the House in the 119th Congress, H.R. 909, and we are up to 137 co-sponsors in the House as of this morning. And it will be reintroduced in the Senate very soon. These are bipartisan bills. You can see on the slide who the leads are. But this is a bill to help supplement the up and downness. That's a real word, the up and downness of the Crime Victims Fund. What this bill does, it redirects for the next 5 years. This bill is just for 5 years in order to get the fund in a more stable position. Unused funds from the False Claims Act that would be going back to the General Treasury, and instead these funds would go into the Crime Victims Fund to support vital programs that are needed in every state, and that I know you've been hearing a lot about. We hope if your bosses aren't on HR 909, you will consider doing so. We had almost 218 co-sponsors in the last Congress, and we are expecting any moment Senators Murkowski and Durbin to reintroduce the bill soon. But once that happens and we have a bill number, you will be hearing from many about hoping your bosses will co-sponsor that as well. The next program I wanted to talk to you about is the Sexual Assault Services Program. This is authorized as part of the Violence Against Women Act, and it is the only direct fund authorized program that directs service dollars for rape crisis centers. Interestingly, this program was not authorized until 2005 as part of the Violence Against Women's Act in fiscal year 24 and fiscal year 25. It's been funded at 78.5 million. These funds go out by formula to all states, and then the states once again get that funding down to local programs. And there also is funds available for state sexual assault coalitions as well. So this is critically important. Once again, dollars that go directly for services for sexual assault survivors. Then on the prevention side, which as Terry and Maureen have pointed out, the importance of if we wouldn't need any services if we could prevent, right, violence in our communities in the first place. The rape prevention education program is critically important to programs around the country. It also is authorized as part of the Violence Against Women Act. However, program implementation and funds are directed out of the Center for Injury Prevention and Control at the CDC. Fiscal year 24 and 25 appropriations were 61.75 million. This money also goes out by formula to every state's health department. Many health departments work directly and just pass through the money to state sexual assault coalitions, not in all states, but the money goes out to every state and it goes down to prevention programs. I must mention here, with the reorganization at HHS this week, that was announced Monday night, Tuesday, the whole office of the rape prevention education program managers was let go. So this, of course, is of great concern because the money's there for fiscal year 25. And of course, we are concerned, don't understand quite yet how the money will be getting out the door to finalize fiscal year 25. We will be watching this closely. If there's delays, you probably will be hearing from us, and we might be hearing from constituents as well. But I just needed to point that out. The money's there. We're not really sure what's going to happen with the office because there doesn't seem to be, the original staff are not there at the moment. But this is incredibly important, and it is funded at $61.75 million. This has been level funded for the last few years, and so we as advocates and stakeholders will be asking for more money in this fund. And but obviously we understand the tight fiscal constraints we're looking at, but as you will be hearing from your constituents that money for prevention is critically important and must be increased. And the last program, pot of money I'd love to draw your attention to is for rape crisis services and a new partnership initiative at the Office of Family Violence Prevention Services, which is a program within the Administration for Children and Family. We are asking for $100 million to continue funds that are there that also have gone directly out to states and down to rape crisis centers. Also, we are about to, this month, in April, as Sexual Assault Awareness Month, about to introduce a bill in both chambers that will be bipartisan, looking at a new $30 million initiative to look at the intersection of and encourage partnerships with sexual assault programs, community health centers, mental health, and substance use programs. As I think, as you can all well imagine, the intersection of many of these issues for sexual assault survivors are all too common and complex. One goes through a sexual assault with often lingering mental health, physical health issues that span the lifetime. that was also pointed out by Terry at the beginning of our presentation. And we really want to encourage sexual assault programs to work in partnership and to train and help other providers in the mental health, substance use, even the child welfare space understand the trauma of sexual assault survivors. And there is evidence around the increased risk of cervical cancer and sexually transmitted diseases. Obviously, not obviously, but often, as you can imagine, anxiety, depression, post-traumatic stress disorders, and even evidence of lifelong chronic illnesses like an increased risk of heart attack and heart disease than non-victims. And so you'll be hearing more about this. And I just really want to thank you for keying in on these critically important funding streams for sexual assault survivors. And I'm going to hand it back over to Terry now.
Thank you so much, Ellen, for laying out those really important specific requests we have for this Congress and this FY26 appropriation cycle. And Maureen for really laying out the data that shows the need of rape crisis centers. We want to turn it over to some guest speakers now so that you can get a better picture of what's happening on the ground. So we will have 3 guest speakers. I'm going to just introduce them briefly now, and then they will go back to back without me coming back for a minute. So our speakers today are Sherry Hyatt, Executive Director of Family Services of North Alabama, a local program in North Alabama. And then 2 coalitions, statewide coalitions. You'll hear from Nancy Hoffman, Executive Director of the West Virginia Foundation of Rape Information Services, and Rose Luna, who's an NAESB board member, as well as the Executive Director of the Texas Association Against Sexual Assault. So now I'll hand it over to Sherry, and we'll stop sharing the PowerPoint for a minute.
Thank you, Terry. Good morning. And thank you for the opportunity to speak with you today. I am here representing Family Services of North Alabama, and I want to talk to you about something that is both deeply personal for so many and critically important to our nation's economy. It's the staggering cost of unresolved sexual trauma and the economy-boosting impact of prevention and support programs when they are properly funded. Unresolved trauma, specifically sexual trauma, is not just a personal burden. It's a public crisis with a massive price tag. According to the CDC data, a single instance of rape is estimated to cost society over $122,000 per survivor. This includes medical costs, lost productivity, criminal justice expenses, and the lifelong impact on mental health. When we zoom out, the national cost becomes overwhelming. The CDC estimates that over 25 million adults in the U.S. have experienced rape. That brings the total lifetime economic burden to a staggering $3.1 trillion nationwide. But these are not abstract numbers. They represent the real strain on healthcare systems, legal systems, social services, and local economics. In Alabama, that cost hits home. One victim of sexual assault costs the state approximately $38,000 in the first year alone. This factors in medical care, law enforcement, legal proceedings, mental health services, lost wages, and other ripple effects on social services. If you multiply that by the thousands of cases reported and the countless more that go unreported, the burden to the state, it climbs into the hundreds of millions annually. And when trauma goes unresolved, the costs don't stop. According to national research, the long-term economic cost of unresolved trauma can reach $210,000 or more per person over a lifetime, much of which falls on public systems like Medicaid, disability, and social services. And that's why the Rape Prevention and Education Grant is essential. This federal funding allows us to implement evidence-based strategies to stop sexual violence before it ever happens. Without this grant, the preventative net that we cast would shrink drastically and the long-term costs would only grow. So we're asking for continued and increased federal investment in agencies like ours. Why? Because prevention alone is not enough. Survivors need pathways forward, and that's exactly what we can provide. Our workforce development program is a powerful example of how federal support can create long-term economic change. Survivors in our victim services program, they're given the opportunity to earn their GED, to learn job skills, and to receive full support to obtain professional certifications in high-demand fields. We don't just help survivors heal. We help them rebuild their lives and contribute to the economy. For every dollar that's invested in trauma recovery and workforce training, the return can be 3 to 5 times as much in reduced public assistance needs and increased economic output. We know what works because we're the ones doing that work, but we cannot do it alone. We need your support to sustain ARP, RPE, and VOCA funding, and to ensure that family services in North Alabama and agencies like ours across the country have the resources to continue transforming trauma into triumph, one survivor at a time. So I'll leave you with this. If Family Services in North Alabama can assist 100 survivors in securing a career with an average salary of just $30,000, 100 survivors making $30,000 a year, that means we have injected $3 million into the state's economy annually. 100 survivors into the workforce means our agency has saved Medicaid over $600,000 a year. 100 survivors in the workforce means our agency has saved almost $300,000 in SNAP benefits. So ultimately, that means Family Services in North Alabama has saved over $900,000 in government assistance and has given an economic boost of $3 million in taxable income to the local economy. One agency is contributing $4 million to the economy every year. One rape crisis center out of almost 1,500 across the United States. Can you imagine what victim services providers like ours can do for the economy on a national level if we were made a priority? Thank you so much for your time, for your service, and for your commitment to our country. I will now hand it over to Nancy. Thank you.
Thanks, Sherry. What a great example of the work that is being done and needs to be done, obviously, across this country, and demonstrating the outcomes when we provide that support for victims. I'm Nancy Hoffman, and I am the state coordinator with West Virginia's State Sexual Assault Coalition, and I'm going to talk a little bit about how services and prevention are expanded in our state through all of these funding streams. As a coalition, we are the network for our state's rape crisis centers. We're kind of that hub that streamlines and elevates the response to sexual violence in our state. So for example, rather than each local rape crisis center having to figure out trainings and resources for their staff and working with training for law enforcement and prosecutors in their communities, we do that on a state level through our coalitions. We also, as a coalition, provide our training for forensic examiners in sexual assault cases in our state. So we're really working to ensure that all responders are aware of our current laws and have trauma-informed responses. And all of that is done primarily through Violence Against Women Act funds. Our coalition was actually created from Preventive Health Services Block Grant Sex Offense Set-Aside monies back in 1983, and that amount was $25,000. And I know that sounds small, but it really is that seed money that provides that catalyst for change in a state and providing foundational support. In most states, but particularly in rural states, federal funding is critical for services to actually exist. When those SASP funds, the Sexual Assault Service Program funds, first became available, we only had 9 regional rape crisis centers for our state's 55 counties. So we had 14 counties, 25% of our counties just were not being served. Those victims did not have access to services. And you can see on the map that's in the chat that we are now bringing on in West Virginia our 12th center, which finalizes 100% coverage in the state with 24/7 services. This would not be possible without expanded and continued support through the SASP funding, as well as VOCA support. I know Ellen spoke about VOCA funding as a crisis in this country, and it is. I'm sure all of you have heard from your constituents about that. We anticipate in West Virginia, starting in October, a 76% cut in funding for those services if there isn't some level of federal or state intervention. What that means specifically when we ask those 82 agencies in our state that are funded through VOCA, because it funds domestic violence shelters, rape crisis centers, child advocacy centers, a variety of victim service programs. They reported in a survey that we would lose 289 staff positions, service positions, in addition to 163 staff positions being reduced to part-time. That's almost 500 victim service positions lost, with complete program closure in 45% of the 82 agencies that served 50,000 victims in our state last year. So funding for support for victims is critical through SASP and VOCA, but we also need to focus on prevention, as Sherry said. In West Virginia, the #1 reason for someone who's incarcerated is forcible sex offenses. It's not murder, it's not drugs, it's forcible sex offenses. And our state alone spends over $46 million annually on incarcerating offenders for sex-related offenses. And that's just in our prisons, 46 million just in our prisons. That doesn't include our jails, doesn't include our juvenile facilities. So investing in prevention is critical on many levels because the cost of sexual violence is high, both to victims and for incarcerating their offenders. Prevention is what the RPE program helps us do, our rape prevention education funds. I have to confess that prior to RPE funding through VAWA in 1994, we were teaching stranger danger, and that was true, I think, across the country, that who was likely to be a rapist was a stranger basically lurking in the bushes at night. And it was through data from CDC and guidance from them that we learned instead that you are most likely to be assaulted by someone you know. I think Terry provided and shared that data. We were catering or focusing on 12% of stranger danger as opposed to the 88% of folks assaulted by someone they know. So the data helps us do effective prevention work with our limited dollars. We used our RPE funds to identify who's most vulnerable in our state to sexual victimization. And in our state, which is probably not uncommon, they're children, college-age adults, and people with disabilities. And we've created programs, prevention programs, to reduce the risk of those populations. For example, we formed a statewide intercollegiate council against sexual violence, bringing together our campuses in 2003 to network with them on how to do effective prevention work. That group is still as active as they were 20 some years ago, and they still meet quarterly. So these funds have a major impact. They also help meet unfunded federal mandates, like the Campus Save Act. There's a federal mandate that requires that the prevention programs be presented to all incoming students, but that mandate has no funding attached to it. Our state has an unfunded mandate requiring prevention programs annually in all classrooms, every classroom K through 12. These are wonderful requirements and wonderful prevention opportunities. And it's the RPE program that provides the funds for us in West Virginia to actually implement effective prevention programs for our most vulnerable populations. So I appreciate the opportunity to share a snippet of the impact of what these funds are doing in West Virginia. I want to turn it over now to Rose Luna to share the impact of those dollars in Texas.
Thank you so much, both Sherry and Nancy. Wow, it's great to hear all the wonderful work that you all are doing in partnership with what we're trying to do here in Texas. But thanks again, everyone, for joining us. I know that your time is very sacred right now. There's a lot to do. I know in Texas we have legislative session, so I am honored to be asked to be on this panel and also honored to share the amazing work that's happening through our partnership with our federal elected officials in the money that we get here in Texas. So again, my name is Rose Luna. I'm the CEO of the Texas Association Against Sexual Assault. And to set the stage before I talk about a little bit of the snapshot of what's happening happening here with the federal dollars. Texas has 254 counties. That is huge. We only have 73 sexual assault programs. We call them rape crisis centers and sexual assault programs interchangeably, so I apologize if I use both terms, but I'm talking about the same types of organizations. But I wanted to thank you all for allowing and advocating and writing those statutes and having those conversations on behalf of sexual assault programs or rape crisis centers across the country. I know I can only speak for Texas, but it has been a game changer, especially with the American Rescue Plan grants to sexual assault survivors through that FIPSA office that we talked about earlier, through the Administration of Child and Families. Very thankful for that in Texas. That again, that has been a complete game changer. The way that we did that here in our state is TASA. We were the pass-through organization, so we worked with our governmental entities to ensure that that money would be used in the proper way to address sexual assault and sexual violence here in the state. So with that particular grant, we were able to assist with including virtual and mobile services, virtual to expand the reach of those services. As I mentioned, we have 254 counties, only have 73 programs trying to reach and extend all those counties. So this allowed us to be a little more intentional, not only with the underserved areas, especially in rural Texas, because there's vast lands and things like that, but it also helped us to decrease the demand of wait list in our urban areas, like in our cities, like in Houston and Dallas and Austin and things like that. It also allowed us to have increased emergency needs for survivors because there's all those needs. This grant was allowed us to be able to respond to some of those things that other grants just wouldn't cover. So this particular grant in the state of Texas, what it did is we had over 13,000 instances of medical accompaniment and law enforcement accompaniment. And I just wanted to say that those would not have been able to have been done without this funding. So again, the reach is there, it's expanded our ability to serve all survivors, especially in rural counties in Texas. It also allowed us to provide almost 30,000 instances of advocacy services. When someone is going through this, something that they did not ask to go through, to have an advocate there to help them navigate this daunting system, whether it's the criminal justice system or any system. We are proud to say that with that money, we were able to do that over almost 30,000 times in the state of Texas. And also with counseling, that's the one thing that we are always have a shortage of or a wait list for. With this money through the American Rescue Plan through sexual assault survivors, we were able to offer almost 37,000 instances of counseling services to Texans that would have not been able to get that without the funding. This grant, we were able to give 26 grants to 22 organizations that spanned 76 counties. So this really made a huge dent. And so we are very thankful and just wanted to share those success stories with you all. The other federal funding grant that we are able to pass through to our organizations in a very intentional way is the Sexual Assault Services Program, or the SASP. So what we have done there with that grant, so the information I'm going to provide to you is just the last grant, the grant cycle. We were able to provide case management to almost 8,000 individuals in the state of Texas with that. And also we were able to provide counseling and therapy for over 11,000 sexual assault survivors in Texas. Again, this would not have been able to get done had it not been for those two grants. And that's a huge impact. So again, thank you so much for your help and your assistance in that. And the other thing we wanted to highlight is we were able to get a grant through the Edward Byrne Memorial Justice Assistance Grant. So I say that because when I started in my position here at TASA, I wanted to be able to build relationships with law enforcement, or to strengthen our relationships with our law enforcement partners across the state. And one of the options was to be able to provide a law enforcement sexual assault training that was not being done anywhere else in the state of Texas, that was solely specific for sexual assault investigations for law enforcement. So we were able to make those connections through that and to be able to build and gain trust. So that particular federal grant has been super tremendously successful here in the state of Texas. It has incrementally grown each year. That's a grant that it's a federal grant that we get through the governor's office, and we're all of us are proud to be able to have that those trainings. One of the success stories that we heard from this past training is a couple of officers that attended from the Panhandle area of Texas. After attending this training, went back and opened up 6 cases that they had closed. Of those 6, 4 still remain active. Of those 4, 2 resulted in arrests. So as a result of your fight for and your work with on the federal level to help us get the money here in Texas, we were able to increase public safety in that area of Texas. Also, we heard back from 2 other officers that attended in another rural county that were punted a case from a neighboring county with more resources because they said the jurisdictional issues, whatever that was. However, they were saying there's no there on this case. Well, those officers were proud to report back to TASA that they were able to file formal charges of felony sexual assault on those cases that this other county who did not attend, did not see fit to file charges. So just wanted to say thank you. And those are the kind of impact stories that we get. And on the front of us building our relationships, I told myself that if we're able to get a cop from rural Texas to call us for support or to call us about questions, that we will have made it. And I'm proud to say that not only did we have that one cop, we have several that call us from all over the state to ask us for support, to ask for our information, and to ask us to come and do trainings as a result of that one training, the federal fund that you all helped us with. And also, they have in Texas or in the South, barbecue is a love language, right? So we have been offered barbecue lunches for them to come. So if someone offers in our state, if someone is offering to barbecue for you, that is a love language beyond. That's almost up there with marriage proposals. So we're just very proud of that. But we are thankful that this federal fund that has allowed us to build those bridges, but also improve public safety and services for survivors of sexual assault in Texas. And the last thing I'll say is with CDC, there's only one in the state of Texas. We only have one revenue source for prevention. We are all in favor. I think in the state, like at a state level, we're all in favor of prevention. There's just no state dollars for that. The only source for us in Texas is through the CDC, the RPE funds. And so we are the thing that I am a little concerned with is I know that there's things that are out of all of our control. I know that there were some cuts with some of the staffing there. And so my only concern is the disruption of services that may happen at the local level because our programs are just fearful. They are trying to understand what these are. We're communicating with them to say the funds are safe. You know, everything is safe. There's just some changes happening. But I think the abrupt changes, again, not out of all of our control, are having a slight impact on the ground. So I just wanted to offer if there's anything that we can do to help provide information to you all or to any entity to just provide some context on what's happening. But also just wanted to report that there are some folks that are still shaky. We're working on that. But if you hear from constituents on that just to give you all context on what's happening in regards to the state of Texas and prevention and some of the things that were happening. But other than that, I really thank you all and shout out to the folks from Texas if you're on or if you're listening later. And thank you, all of you, for everything that you do. The funds really matter, and I appreciate your attention this morning. Thank you.
Thank you so much, Rose and Nancy and Sherry. I always feel just so inspired hearing from the local programs and coalitions who are doing this work day in and day out in their communities. I think you've heard from them the importance of the work of rape crisis centers, both in terms of providing services and prevention, and this fragile moment we're in where folks are concerned about their federal funding, both in terms of the flow of the funding, but also in terms of the administration of those funds. So keeping an eye on that. You heard from Ellen, some really important specific requests that we have this year. You've heard some about the data. We just want to leave you with the idea that we hope you will be with us in supporting investing in solutions. We really feel like the effectiveness of funding sexual assault victim services and prevention is clear, that it works, it saves money. And it's the right thing to do, absolutely, for victims. Victims deserve that support. They deserve to get their lives back. They deserve everything we can do to make that go better for them. But it's also a strategic move toward a healthier, more prosperous future where fewer lives are impacted by violence. We really believe that investing in solutions today means fewer crimes of sexual assault tomorrow. We're so grateful you've been with us. If there are any other questions, please feel free to drop them in the Q&A, and we will address them in the Q&A as we can. But I want to turn it over now back to Monica Johnson Hostler, our President and CEO, to bid you all farewell. And we're just so grateful for those of you who are able to attend today, take time out of your busy schedule to learn more about this important work, and know that you'll continue to hear from the National Alliance to End Sexual Violence, your state coalitions, and your local programs. So back to you, Monica.
Thank you so much. Thank you, Terry, Maureen, Ellen, Rose, Nancy, and Sherry for sharing your heartfelt work. And of course, a little bit about Texas and barbecue really does speak to how it is important that we are not just hubs, but we are integrated into our community in meaningful and familiar ways. So thank you for sharing all of your stories, the deeper dive into the critical roles that you play in our communities, but most importantly for our survivors. It continues to be important for federal funding to ensure that our programs can continue to serve survivors. Each of us has a part to play, as you've heard today, in addressing and preventing sexual violence. We know that your time is valuable, so we are especially grateful that you've taken the time to join us today and to show your commitment to this important cause. Again, as Terry noted, we still have people responding to the Q&A, so if you have questions or follow-up, please ensure that you reach out to Terry Poor, who you will receive her email and contact if you do not have it at a later date, and you'll also have people dropping contact information in the chat. So again, it is our pleasure to continue to work with you to ensure that we know together we truly believe we can prevent sexual violence. Thank you all.